This study highlights the connection between dysglycemia and vascular impairment across different levels of circulation, emphasizing that individuals with prediabetes and diabetes are more likely to experience microvascular dysfunction in the skin, arterial stiffness, and coronary atherosclerosis compared to normoglycemic individuals. The researchers analyzed data from 3,300 participants aged 50 to 65, drawn from the Swedish cardiopulmonary bioimage study, SCAPES. They used a specialized protocol to measure microcirculatory function in the forearm skin, assessing peak blood oxygen saturation, OxyP, after arterial occlusion. Additionally, they measured pulse wave velocity, PWV, to evaluate arterial stiffness and used coronary artery calcification scores, CACS, as markers of coronary atherosclerosis. Participants were categorized into normoglycemia, prediabetes, and diabetes based on fasting glucose and HbA1c levels. The results clearly showed a progressive decline in microvascular function with worsening glycemic status. OxyP was significantly lower in both pre-diabetic and diabetic participants compared to normoglycemic individuals, with the largest decrease seen in those with diabetes. At the same time, both PWV and CACS increased with worsening dysglycemia, reinforcing the association between impaired glucose regulation and vascular dysfunction. Notably, the prevalence of combined impairment across all three vascular levels, microcirculation, arterial stiffness, and coronary calcification, was substantially higher in individuals with diabetes. These findings support previous research, suggesting that microvascular dysfunction is an early marker in the pathophysiology of diabetes, potentially preceding the onset of large artery and coronary calcification. While hyperglycemia has long been recognized as a contributor to microvascular damage through oxidative stress and inflammation, this study adds to the growing evidence that vascular impairment is present even in the pre-diabetic stage. This raises important clinical questions about whether early interventions targeting microcirculation could help mitigate cardiovascular disease risk in individuals with dysglycemia. Despite its strengths, including its large sample size and standardized methodology, the study has some limitations. The cross-sectional design prevents conclusions about causality, and the use of skin microcirculation as a proxy for systemic microvascular health may not fully capture the complexities of microvascular dysfunction in diabetes. Additionally, the uneven distribution of participants across glycemic categories means that the normoglycemic group was much larger, which could influence statistical power in subgroup analyses. Overall, this study reinforces the importance of early vascular assessment in individuals with prediabetes and diabetes. By highlighting the link between microvascular dysfunction and macrovascular disease, it suggests that impaired microcirculation could be a potential early warning sign for cardiovascular complications. Future research should focus on longitudinal studies to establish causal relationships and explore whether interventions to improve microvascular function could help reduce the burden of cardiovascular disease in people with dysglycemia.